So orphan drugs, that term is kind of came from what they call orphan diseases. So an orphan disease is a disease that's typically genetically inherited, not all the time, but fewer than 200,000 people in the US have that disease. So that's how it's been defined. So a relatively rare condition. And up until 1983, there wasn't a lot of research and development going into medications for these diseases, right? Because there wasn't much of an incentive, not that many people have these diseases, why should we put money into it? But there was legislation in 1983 to encourage drug manufacturers to put more money and time into researching and developing, some medications. So there were a couple of incentives. They actually gave, manufacturers that are looking into coming up with solutions for these orphan diseases, instead of 5 years of market exclusivity when a drug is kind of like a patent, right? They gave them 2 extra years, so 7 years of exclusivity. And they also gave them a 50% tax credit for the costs that they incurred during the evaluation of the medication. So with those 2 changes, there has been significantly more pharmaceutical interest in developing medications for these orphan diseases. So I've given a couple of examples here, and I'll talk about one other ones, but from a cost perspective, gene therapies are an area that they're really looking into, changing some like a quick shot that will cure a disease. So the first one, and again, I don't pronounce things well, so the first one up there, starts with a Z. It is a solution for spinal muscular atrophy, which affects 300 babies born in the U.S. each year. So again, not super common, but the cost of that medication is $2.125 million. Cures the disease, and so it's all very good at the end, but just again from a cost perspective. And interestingly, the drug manufacturer of this, which I believe is Novartis, offered insurance company a payment plan for this, so they could pay $450,000 over 5 years, or whatever, close to that, what the math works out. So they wouldn't have to come up with $2 million initially. They welcome to a payment plan on it. So that's kind of funny. The other bullet up here, again, another Z, is to treat condition beta thalassemia. But the cost for that is $1.8 million. I actually have another client that has twins that does have this condition, and they're being treated now $300,000 a year per child. And once this drug hits the market, which is expected to be approved in 2020, it'll again be $1.8 million for each of those, as long as it, hopefully it'll be a good fit for them. The third one, not up there, but it was the first gene therapy that was approved in the U.S. It was called Luxturna, and it was to heal blindness in children. So children that were born with a certain eye condition, 1 or 2 treatments per eye would stop their blindness for the rest of their life. And the cost is $425,000 for that treatment per eye. So just trying to put, again, a little bit of perspective on the costs of some of these medications. But interestingly, it's not just those orphan diseases that have succumbed to costly price increases. So we're looking here at, in the first 6 months of 2019, there were 3,400 drugs that increased their prices, 17% higher than 2018, and the average increase was 10.5% for these 3,400 drugs. 41 drugs boosted their prices by more than 100%. I'm just giving you a sampling of them. Again, just recognizing that it's not just those, orphan drugs, but kind of across the board, brand name, generic, there was a tremendous increase. Prozac, 879% increase. The next one down, which is an asthma medication, 381%. The next one down is a cough medicine, prescription cough medicine, 326%. And the last one is an AHDH and high blood pressure medication increasing. The reasons for some of these increases, especially in the generic market, is profitability. So the generic manufacturers are recognizing, okay, this is an area that we could also stand to get some profit from. Some prescription shortages, the EpiPen was an example of that. And then also consolidations within the pharmacy manufacturing environment as well. So I see you shaking your head. I agree. It's just kind of like, oh my gosh, crazy, unbelievable. Right, right. So we're going to take a look at some of the reasons why the costs have increased. Research and development for new medications, that's the top bullet. Not really a surprise there. That continues to be a driver, but I look more at the next two as far as why over the last year there's been such an increase in the medication costs. Second bullet there, pressure from shareholders to deliver higher profits. So let's not forget these manufacturing companies are there to make a profit, right? So someone's life is on the line and needs the drug. It gives them a lot of pricing flexibility as far as what they want to charge for that drug and how much an insurance company or a person will pay for it. And then the third bullet there's no federal law or regulation to effectively keep drug prices in check. So in 2019, there were 50 separate legislation pieces that were either introduced the House of Representatives or the Senate, and none of them were signed into law. And then this was really interesting. It was an article I was reading this morning that there was some legislation to try to import more medications from Canada, but Big Pharma, so that's all the pharmaceutical companies, they threatened Canada that they wouldn't sell certain medications to them if they allowed this legislation here in the US to move forward. So there's a lot of different factors that are going on kind of behind the scenes, legislatively, stock market wise, and then of course you have the research and development. So one of the ways that as a healthcare system that we have devised for providing and negotiating the cost of medications is the use of a pharmacy benefit manager. Acronym is PBM. So to put that into perspective, in your world, your pharmacy benefit manager is Maxor Plus. Other ones that you might be familiar with, Magellan, CVS, Caremark, EnvisionRx, MedImpact, Express Scripts. These are all examples of what's known as a pharmacy benefit manager. And really where their expertise is in the their clinical expertise as well as their negotiation power with drug manufacturers and pharmacies. So they're kind of a middle person. Insurance companies do rely on them. Insurance companies don't have their own clinical knowledge unless they purchased a pharmacy benefit manager. But again, it's kind of a standalone entity that has created a space for themselves to help with bringing the pharmacy to us through the insurance companies. Their goal is to reduce pharmacy drug spending through better negotiations for higher volume purchasing of medications, help patients achieve better health outcomes, and then they also offer clinical programs that they manage and communicate to employees, such as the prior authorization process, safety precautions, and then savings opportunities. So that just hopefully gives you a little bit of an explanation of what, in your case it's Maxor Plus, and what part they play in the role of your program. So we're now going to move into probably the more the meatier section of best ways to save money on RX for you. Some of them you'll be familiar with, other ones hopefully something new. And again, what I'm going to talk about now are all included on a paper handout over here, okay? So generics, again, no new messaging there. Try to find generics when available. Mail order for a 90-day supply. So it's less costly to use mail order the majority of the time. Because it's mail order, the actual cost of the medication is less than if you were to get it at the pharmacy. And you also, the plan, your medical plan does incent you to give this a try by only charging 2 copays for a 90-day supply as opposed to 3, 30, 30, 30 if you for your medications. So typically there are maintenance medications, so your high blood pressure, cholesterol lowering medications, things like that would fall into this category. So convenience of receiving them at your home, and then again the less cost reduction for you. The third example up here is the use of alternative medications. So I do have a statistic that 70% of expensive prescriptions have alternatives. And I've just given you one example up here, Xarelto. It's about $550 per month for the cost of Xarelto. older version or an older type medication, warfarin, is about $19 per month. So again, there's a lot of direct-to-consumer advertising on TV and in print ads whenever the latest and greatest drug comes out. But just be mindful that there are plenty of other older versions that still work just as well. Maybe you take 2 pills a day instead of 1, but from a cost perspective, if you're looking at ways to manage your costs, that's certainly something to ask your doctor about, ask your pharmacist, or do your own research on, okay, what are some of the alternatives that would still work. Of course, always recommend that you talk to your doctor about it. Number 4 here, over-the-counter options. So what this is talking about are for those medications that have recently come to market and they end up being a combination of either 2 over-the-counter medications, 2 generic medications, or again, a combination between over-the-counter and generic medication. So the example that I'm showing you is called Duexis, and it's $2,600 cost for that medication. And all it is, it's ibuprofen and famotidine. Famotidine is an acid reducer, like a Pepcid. The 2 separately, if you buy them, take them together, it's going to cost you less than $19. If the prescription, it's $2,600 for that prescription. Another example, not up here, but it's called Zegrid, and what that is a combination of is omeprazole and sodium bicarbonate, which is baking soda. So again, it's in that same sphere of acid-reducing stomach, stomach-settling medication. It's $86 per pill versus 47 cents if you were to take the omeprazole and baking soda combination together. And what that works out to for a 90-day supply is Zegrid is $14,000 for a 90-day supply versus $76 if you were to use just kind of the old-fashioned combination of sodium bicarbonate and the omeprazole. So just 2 examples. It's not going to fit into everybody's wheelhouse all the time, but again, meant to be suggestions here to talk to your doctor about. Some other suggestions are talking with your pharmacist on affordable options. Another good tool is your Maxor Plus online technology capabilities. There's a flyer about that here on the table. Ways to research cost for your medications at different pharmacies. Using manufacturer discounts and coupons. Typically, you can either ask your pharmacist about that or find online coupons or discounts for your actual prescription. Patient assistance programs, again, online is your best source. Typically, they are more of like a financial need-based type arrangement, but it doesn't hurt, to give that a whirl too. The next suggestion would be, take time to research the drug prices because the cost of medications do differ from pharmacy to pharmacy. So I find that GoodRx so www.goodrx.com is a really good resource for trying to find out what the cost of medications are at different pharmacies. They're not always exactly right, but if it's less expensive at Rite Aid than it is at, say, a Hannaford, even if the dollar isn't exact when you go to Rite Aid, it's still going to be less expensive than had you got it at Hannaford. I'm just picking on those 2. I don't really know if one's more expensive or less expensive. But as a reminder, the GoodRx program, it's completely outside the scope of your plan. You can use a GoodRx coupon for a medication, but if you then purchase the medication, it's going to be out of pocket and it's not going to go towards the cost of your deductible. This isn't anything new, but just as a reminder. So while GoodRx does offer significant savings, in many, many instances, you just have to be mindful that it's not going towards your deductible. It's not accumulating towards anything. It's completely outside the scope of your plan. Again, what I like to use it for is because I have a high deductible health plan as well. And again, I like to price shop and figure out, okay, where's my medication the less expensive? Then I'll go and I'll present my prescription card, but at least I know that I'm getting the best deal. The other suggestion here is remembering to maximize your health savings account. So the combination of maybe what you put in and what your employer puts in. In 2020, the most that you can contribute to your health savings account, combination of employer and yourself, $3,550 if you're a single, $7,100 if you're enrolled in anything but a single. And then if you're over 55, you can put in an additional $1,000. So remember that you have that available to you as well. If you have, out-of-pocket costs, why not put it into your health savings account, and then you're getting the advantage from a tax standpoint. Because money that you put into your health savings account is put in on a pre-tax basis. So that's where that advantage comes in. It's lowering your taxable income. The last slide, I feel like I've gone a lot more quickly through these slides than the first session, but the last reminder too is the program completely voluntary called Captivated Health Meds. And what this is, it's a program, again, it's separate from Maxor Plus, but it is part of your medical program. It's your choice as to whether or not you want to use it. And it relies on the international prescription service provider known as CannaRx. So it's up to you to take that initiative, to take a peek and see if your prescription is one of the prescriptions that's listed on the CannaRx formulary. There is a listing up here of the prescriptions, as well as information on how to enroll in it. The advantage is that it's at no cost to you. So your copays are waived, your deductible is waived, it's still processing, through the plan, through Maxor. And the other, on the flip side, is that a lot of times these medications, because they're coming from an international entity, they're coming either from Canada, the United Kingdom, or Australia. They are all brand names. They come in their, initial packet, their original packaging, but they tend to be at least half the cost of what you can get them in the U.S. for. So it's saving the plan money, right? So it's at no cost to you, and then significant savings from the plan. So in 2019, there are people here, right, that are already using this program. Actually, there was a gentleman in the last session that, spoke up and said how much he liked it and it worked well for him. So I was happy to have him in the session. So the usage here at Philips Exeter, we've had 72 prescriptions filled in 2019. The plan saved $71,000. So again, that's absolute savings to the plan. Cost of all your medications and your medical claims this year becomes the cost of the program next year. So claims today are your premiums tomorrow. So advantage again, no cost to you, and saves the plan money. So up here is, again, another snapshot of Philips Exeter's utilization of medications. So I'm looking at this. If anybody grabbed this, I just wanted to explain what this handout is about. So this is showing prescriptions that were used by Philips Exeter members that could have been purchased through CannaRx, and then what the savings would have been to the plan. So there would have been $68,000 in prescription savings to the plan had people used CannaRx program. And you can see here, again, the name of the medications, the strength, so we did an apples-to-apples comparison, the average cost per fill for 30 days on the current program, and then the CannaRx 30-day cost, the difference, and then the savings calculated. But you can skim your look down the names of these medications, and they are all brand name. You're looking at your Xarelto, your Wellbutrin, Advair, Brio, Cymbalta. So a very extensive list of medications that CannaRx does offer. So again, meant to be another bullet up here for cost savings for your prescription programs.
Can I ask you a question?
Yes.
In these two different prescription things for mail order, say 90-day mail order, if you just have a short-term prescription, is there any reason to try to do this? Or?
No, this is strictly, so both the mail order, the 90-day supply through Maxor Plus, as well as this program are meant for your longer term, at least 90-day supply, maintenance, preventive type medications.
Okay. So you need this prescription to be written for 90 days plus?
Yes,
yeah.
yes, yep. The initial prescription, and again, the steps are explained for the CannaRx program up here. There's a couple of different steps. You do have to get a prescription from your physician here. You have to fill it once in the Maxor Plus program, and then from there you can transition your prescription over to the CannaRx program. Again, completely voluntary, but for a lot of people there is savings to them because you use one of these medications, and you'll get it at no cost through CannaRx, as opposed to in the last meeting there was a gentleman who was saying he was paying $50 a month for it, then switched it to CannaRx, and now he's getting it for free. He was very pleased with it. So. And if there are any other questions? Okay, well again, thank you for your time. And up here are several handouts that we've talked about. There's mail order, sheet, information about the technology capabilities with Maxor Plus, and then that Captivated Health Meds and CannaRx program. So thank you, appreciate your time.
Thank you. Thank you. And if you're looking